Good afternoon, Mrs. Doe. As your healthcare practitioner, um, as we discussed earlier, you'll be starting on a new medication called Lipitor, also known as atorvastatin, primarily used to treat high cholesterol. Now, I'm obligated to give you some information on what or how it will help you. Lipitor is commonly prescribed medication for managing high cholesterol levels. It's broken down in four stages: absorption, distribution, metabolism, and excretion. It's primarily taken orally. When it's taken orally, Lipitor is quickly absorbed and into one's bloodstream within an hour to 2 hours. Now, can you take this with food? Surely. Food may slow down the absorption, but it doesn't impact the overall amount of Lipitor that's absorbed in your bloodstream. Once it's absorbed, Lipitor primarily binds to plasma proteins in your blood and circulates throughout the body, including the liver. Now, as for excreting, um, the bile eliminates the Lipitor um, throughout your body. Um, Conveniently, it's taken once a day and it's effective for 14 to 30 hours or so. Now, uh, Lipitor, how it functions. It functions by inhibiting a chemical reaction that produces cholesterol, removing harmful cholesterol from the bloodstream. Um, in terms of lowering your LDA, which is known as your lousy triglyceride, Lipitor helps decrease also the risk of heart disease and other heart-related problems. Um, so primarily, it lowers um, bad triglycerides while increasing your good cholesterol levels. Um, for adverse reactions, Lipitor is generally a well-tolerated medication. However, some people might have had experienced side effects from it. I want you to look out for any kind of muscle pain, whether it's weakness or muscle breakdown, what we refer to sometimes as rhabdomyolysis. Um, it can also cause temporary liver problems, which we can monitor through routine testing. Some people might have tingling in their hands, um, feet, confusion, memory loss while taking Lipitor. Um, Other possible side effects are upset stomachs, headache, trouble sleeping, and possible allergic reaction like a rash. Um, However, let me just inform you that these side effects are very rare, but they are still possible. Contraindications for taking this medication um, is that it's that you should it's not recommended for women who are pregnant, and being that you have childbearing age still, I would suggest if you felt like you are pregnant, to immediately stop taking this medication, as it can cause developmental issues in the fetus or infant. Lipitor can interact with other drugs, so if you are taking other drugs, please discuss it with us so we can guide you in how we want you to continue with your treatment. Um, Another issue with Lipitor is that um, any alcohol consumption, whether you have a history of alcohol related liver disease, it's contraindicated for you to be placed on Lipitor. So if you are, please let us know. In terms of considerations, um, and they're not primarily relating to you because, again, um, you're not either a child or an elderly, but just to hit on the topic is that um, any children on the age of 10 um, may not be prescribed this medication. And in terms of the elderly, um, it's advised that our Lipitor might affect their organ functions and as they interact with other possible medications that they likely might be taking. Administration directions. So, Lipitor is taken once a day, preferably at the same time. Remember to swallow the tablet whole, no crushing, with water. And like I said, no crushing or breaking it. You may take it with or without food. But one important factor I want you to take away is that to avoid consuming grapefruit or grapefruit juice while you're taking Lipitor. Um, Keep once you're on this, I want you to continue to update us on how you're feeling while you're on this medication so that we can ensure that you are receiving the best possible benefits from Lipitor while minimizing potential risks.